Hello everyone, welcome to RC407. This is week 3 and we're looking at hemodynamic monitoring this week. This is the first in a series of 3 mini lectures that will look at hemodynamic monitoring. I hope it comes in handy for you. If you have any questions, please let me know. So I go to the first page just to do a quick review of the hemodynamic loop. This is the anatomical structure of the heart and the greater vessels. So the heart is divided between the right side and the left side, of course. Beginning on the right side, we have the inferior vena cava, the superior vena cava, the central venous pressure being measured. Venous return from the superior and inferior vena cava, of course, enter the right atrium. From the right atrium, we have the tricuspid valve into the right ventricle. From the right ventricle, we have the pulmonic valve into the pulmonary artery, which bifurcates into the left and the right. And just a quick reminder, this is also where we get our pulmonary capillary wedge pressure. Blood is oxygenated, CO2 is released, blood returns through the pulmonary vein back to the left atrium. Between the left atrium and left ventricle, we have the mitral valve, or bicuspid valve. From the left ventricle, blood is ejected through the aortic valve to the aorta. ABP stands for arterial blood pressure, of course. So what I've done down below is simply taking the structure and made it linear. Same order. We see the CVP, right atrium, tricuspid valve, to the right ventricle. From the right ventricle, we have the pulmonic valve into the pulmonary artery. From the pulmonary artery, of course, we have the different west lung zones. Pulmonary capillary bed. So I've indicated the pulmonary artery occlusive pressure, or also known as pulmonary capillary wedge pressure, which is reflective of the left side of the hemodynamic loop. So I've got it pointing to the pulmonary vein, which is prelude to left atrium, mitral valve, left ventricle, aortic valve, and aorta, where we have the arterial blood pressure. Alright, so if you remember this and you understand this, then you'll remember the hemodynamic loop. So really quickly, you see the right heart, vena cava, right heart, vena cava, pulmonary artery, capillary, pulmonary vein, left heart, aorta. From the aorta, of course, the artery, arterioles, systemic capillary bed, or tissues, back to the venules, the vein, to the vena cava. Alright, and you'll have these that you'll be able to make copies of as well. So we're going to look at some hemodynamic issues and see how to diagnose those using hemodynamic monitoring. So this first one we're going to look at is a patient with hypovolemia, or decreased intravascular volume, perhaps severely dehydrated. And hypovolemia is fairly easy to catch with hemodynamic monitoring, because when you look at all your pressures are decreased across the board. CVP, which we typically use for fluid status, is decreased. Pulmonary artery pressures are decreased. The mean pulmonary artery pressure would be decreased. Wedge pressure, which is reflective of pulmonary vein, left atrial pressures, left ventricular and diastolic pressures, all of those left-sided pressures, even the wedge pressure is decreased. Lack of fluid, not too much of a surprise. We see a diminished cardiac output. Cardiac output decreases, blood pressure decreases. In an effort to maintain homeostasis, We have an increase in the systemic vascular resistance, so we're vasoconstricting in an attempt to compensate and increase blood pressure. Okay, so across the board, decreased intravascular volume, hypovolemia, pressures are decreased. All right, next slide is hypervolemia, or increased intravascular volume, fluid overload, too much fluid in the system. So now you note that all of the pressures are increased. Too much fluid, too much volume. No surprise, cardiac output is increased. We still have increased systemic vascular resistance due to the fluid. Fluid overload. So quick comparison. Hypovolemia, remember our pressures were decreased. Hypervolemia, pressures increased. Next example is left heart failure, left ventricular failure, congestive heart failure, could be mitral valve disease. All of these affect the left heart. So this isn't a system-wide problem like we saw with hypovolemia and hypervolemia. So this is a specific problem to the left heart. So do a big X over it. We have something that's obstructing blood flow due to these types of issues. So if I have an obstruction here in my hemodynamic loop, and we understand that blood is moving in this direction, well, if we have an obstruction here at the left heart, then blood moving into the left heart is backed up. It increases. So when we see our pressures here, our pulmonary capillary wedge pressure, which is obtained on the right side of the hemodynamic loop. I've written it here on this left side just to remind us that our wedge pressure is reflective of left-sided pressures and left-sided issues. So with obstruction at the left heart, our wedge pressure is increased. The pressure's back up. Most resources indicate the pulmonary vascular resistance remains normal, but PA pressures are increased. References indicate CVP can be normal, but if it's chronic enough and severe enough, we know that these high pressures can eventually make their way back into the venous system. So it might only be a matter of time before the CVP increases as well, depending on the severity of the disease. So again, obstruction left heart, pressures behind increase. We note that in front of the obstruction, we see things decreasing, cardiac output decreasing, blood pressure decreasing, perfusion pressures decreasing, delivery of oxygen decreasing. Attempt to compensate, we might have some vascular resistance on this side that's increasing. Attempt to get the blood pressure back up. Alright, so in brief, left heart issue, here's the obstruction on the left heart. Behind, we see increased values. In front, we see decreased values with our pressures. Alright, this particular problem is a lung problem, COPD, and the increase in vascular resistance due to the blood gases. Lung problem, pulmonary hypertension, lung problem, pulmonary emboli, lung problem, ARDS, lung problem. So here's our obstruction, right? Lung problem, obstruction. So as we see behind the obstruction, our pressures are increasing. In front of the obstruction, for this particular scenario, we see normal wedge pressure. What does that mean? Normal wedge pressure means normal left heart function. Because this isn't a left heart issue, This is a lung issue. So in front of the obstruction, actually looking pretty good. Behind the obstruction, we see increased pressures. Similar to what we had with left heart failure or left ventricular failure, if you're not shown where the X is, if you don't see the obvious obstruction, then looking at the hemodynamic loop, you see the change that has occurred between here compared to here. And you know that between these two is where the problem lies. So, going back to the lung issue, I don't see a big X there, nor a diagnosis. But when you look at your pressures, you see high pressures on this end. To the left of the screen, you see normal values to the right of the screen. So the obstruction has to be somewhere in between. Okay. In conclusion, this is really just to kind of drill a particular point home. We have two different scenarios here. In both of these scenarios, the pulmonary artery pressure is increased, but this is a normal wedge pressure. This is an elevated wedge pressure. Okay? So, to differentiate between a lung disorder and a heart disorder, you'll note that both the lung and heart disorder both indicated an increase in the PA pressure. But if it's a lung issue, meaning it's not left heart issue, wedge pressure is normal. The left heart issue had an increase in wedge pressure because wedge pressure was reflective of left heart. So that's a kind of a quick way of determining what we're looking at. So you can go back and see with these, left heart problem, increased PA, increased wedge. Lung problem, increased PA, normal wedge. Right there, conclusion. I hope this was helpful for you. If you have any questions, please let me know. Thank you.